Hi, my name is Dr. Charlotte Kuss, and I'm the Director of the Nursing Programs here at Northwest Florida State College. I want to welcome you to the Program Information Session for the AS program. This is for you if you're applying to the AS Nursing Program for Spring 2020, either as a traditional applicant or an LPN to RN applicant. If you are accepted, you will begin nursing courses in January 2020. Our program is one of the best programs in the state of Florida. Our NCLEX pass rates are high and have consistently been higher than the state average as well as the national average. We were recognized as one of the top 10 pre-licensure programs in Florida. That includes our area's sister state college ASN programs, as well as most university pre-licensure BSN programs. Our graduates are prepared to enter the workforce to continue their education toward a BSN. The Northwest Florida State College RN to BSN program can be completed in 3 to 5 semesters after your ASN program is completed. The RN to BSN provides a seamless transition to a BSN degree. These are some of the essential performance standards that you must meet in order to be successful in the program. The first one is critical thinking. You have to move beyond memorization to the next level. You must be able to apply the information you learn, and you will learn to develop clinical judgment as you progress through the program. You also have to be able to communicate well, both in writing and verbally, move around about quickly and easily, push and lift up to 50 pounds, maneuver in tight spots, and have the stamina to get through long shifts. Sensory abilities include hearing blood pressures, heart tones and lung sounds, and seeing small print and syringe calibrations. Reasonable accommodations can be made in some areas. Fine and gross motor skills are also necessary. You need to be able to open small medication vials and handle dressing changes, for example. The standards were derived from the job standards from area healthcare facilities. The table shown here gives you an idea of what you can expect the program to cost over the course of 4 semesters. Please remember that some of these are subject to change, and the costs do not include general education courses, travel, childcare, or other expenses, because those are all dependent on the individual student needs. Please do not let the finances stop you from applying. Contact the Financial Aid Office through Rater Central for assistance and information regarding financial aid. There are a variety of scholarships and grants available for you to consider. The AS program in nursing is a full-time program, but may not meet some financial aid requirements for full-time because of the number of credits in nursing courses alone do not add up to at least 12 credits per semester. However, if you add 1 required general education course to your schedule each semester, you will have more than enough to meet the full-time requirements set by many financial aid programs to receive the full amount of financial aid. Most programs provide at least 3/4 the amount of financial aid when taking 9 to 11 credits each semester, which you will have to do in the AS nursing program. Now, on to the application process. This is the selection point system for the ASN nursing program. This is what we go by for the selection into the program. You will find this form on the Northwest Florida State College website under Future Raters, Selective Program Admissions, then scroll down and click on RN Nursing. The point system is in the application packet for each track. Looking at the top part first, you have to meet all the criteria in order to be eligible. Once you meet the entire list of criteria, you fall into the pool of eligible applicants. If we have a larger pool of applicants, eligible applicants, than student slots in the program, which we always do, we utilize the point system to make our selection. So let's look at these criteria a little closer. This is the top section of the form from the previous slide. I affectionately refer to it as the bucket list. First thing you should do is apply to the college. Currently, there's not a charge to apply. If you have been a student before, but have not taken classes in 1 year, you will need to apply as a returning student. To apply to the college, go to the college website and select Future Raters and apply now. You will select AA, Associate of Arts, General, as your academic plan with a concentration of AA pre-nursing. Then you need to complete the nursing application between May 1st, 2019 and June 1st, 2019. The application is available on the Northwest Florida State College website. Again, Future Raters, selective program admissions, and scroll down and click on RN Nursing. Select the application packet for the track you wish to take, either traditional ASN or LPN to RN. Download it, complete the application, and return it to the nursing office and any of the one of the several options mentioned at the bottom of the form. Do not submit the application before May 1st, 2019. And again, the deadline is June 1st, 2019. After that date, no further applications will be accepted. The next item on the list is to view this information session, which you're doing now. So then you must complete the post-test confirmation form by June 1st, 2019. When you're done watching this video presentation, be sure to download the form found in your application packet. You will need to return that form to us in one of the same ways that's listed on the form. Then you must complete the nursing admission assessment exam. More on that in a minute. All the rest of the paperwork must be received by June 1st, 2019, which includes any college placement tests such as your PERT scores or ACT or SAT scores, completion of any prep courses that may have been required based on those scores, on all transcripts, including high school and any other college or university transcripts. If you have not completed college level math and English courses, PERT scores are required unless you were exempt based on graduation from a Florida high school in 2007 or later. Check with a Student Success Navigator for advising if you're unsure. They'll tell you if you need prep courses or not based on your PERT scores. If you need to take a prep course before you are eligible to take college level math and or English Composition 1, you will not be eligible for the nursing program until those courses are completed. Your cumulative college GPA must be 2.5 or higher on a 4.0 scale for any college work completed, and I should say any lower division college work. If you're currently taking courses at a college other than Northwest Florida State College, as soon as you have completed them, you need to get the transcript sent to us. However, they won't include your GPA, won't be included in your GPA computation if the transcripts are not available by the June 1st deadline. If you have a Florida LPN license, or you will be licensed in Florida as an LPN prior to January 8th, 2020, you are eligible to apply to the LPN to RN Bridge program. If selected, you will begin with the second semester of the nursing courses and have different courses that must be completed prior to the January 2020 semester. Although the college does not require you to submit your LPN program transcripts, please do so because I will need them later if you are selected. The components of the HESI admission assessment exam include math, reading comprehension, vocabulary and general knowledge, grammar, and anatomy and physiology. Most people have difficulties with anatomy and physiology, even if they did well in the courses. Practice the types of questions they are asking. Go online to find websites that give you lots of practice questions. Just Google A&P Review. Many students have said that the study guide that that is available for the test is great for every area except anatomy and physiology. So look for other study options. Remember, the nursing admission assessment exam, or the HESI entrance A2 exam, must be completed by June 1st. You can take it anytime up to that deadline. You do not have to wait until the June 1st or till the applications open on May 1st, I'm sorry, to take the exam. To be eligible for the program, you must score at least 75% on each component. There are 5 components, and we do not look at your cumulative score, but the results of each individual score or component. You may repeat the test once before the deadline if you wish. Therefore, take the first attempt early enough to give yourself time to study and take attempt 2 prior to the deadline of June 1st, 2019. And please note that June 1st is a Saturday, so you'll really have to take it by May 31st. Recap. You can take the exam twice between now and June 1st, 2019, and I will accept any scores taken between March 2nd, 2019 and June 1st, 2019. Once you have met all the requirements in the bucket list section, that top section I was talking about, you are an eligible applicant. There will most likely be more eligible applicants than seats available. This is where the selection point system comes in, so let's look at that in detail. If you have completed general education courses at Northwest Florida State College with the grade of C or higher, you will receive up to 5 points, depending on the number of credits completed. If you are a resident of Okaloosa or Walton County, you will receive 5 points. This is not residency as they count it for tuition purposes. If you move to either county and can show proof that you reside there as of June 1st, 2019, such as a utility bill, you are a resident for our point system only. Again, not for tuition purposes if you just moved here. Next, you get points for completing the information session quiz. The more questions you answer correctly, the more points you will receive, up to 10 points, 1 point for each question. Each correct answer. You had to complete the information session and submit the quiz to be eligible. This just rewards you for paying attention and getting the right answers on the quiz. So listen up and pay attention. The next section looks at your individual scores on the admission assessment exam. We take your highest score from each section, assuming you took it more than once. If you only took it once, obviously we'll take your only score for each section and subtract 75 from it because you had to score at least 75% to be eligible. This gives you up to 25 points for each section. We'll see an example in a moment. Finally, if you have any certification in the healthcare field, or if you are a military veteran, you will receive 5 points. This does not include CPR certification. Submit your certificate or proof of military service. Again, I don't want your CPR certificate, but submit any other certificate or proof of military service, a DD-214, or 15 DD Form 22 or 22A, the same way you submit the application and the information session quiz, and we'll consider whether or not it meets the requirements. Please note, you will receive only 5 points even if you meet both methods of qualification for these points. All of these points add up to a possible 150 points. So notice the HESI, the admission assessment exam, is up to 125 out of those 150 points. So that's where you need to concentrate. Here's an example of how to compute your score for the HESI A2 exam, or the admission assessment exam. So just say an applicant does take the exam twice in the exam period, March 2nd through June 1st. Attempt 1 scores are listed, attempt 2 scores are listed. And I will use the purple scores for this applicant. So computing these test points earned, the first one is 94 minus the 75. That person gets 19 points for the first component, 17 for the second, which is 92 minus 75, and so forth, for a total of 73 out of a possible 125 points for the admission assessment exam. The applicant with the highest point totals are admitted first until the class is full. If there is a tie among point totals prior to reaching program capacity, we use the following formula to determine selection. Your GPA times 25 plus the cumulative score on the admission assessment exam. So here's an example for that. There's a tie and we have one spot left and two people with the same exact number of points. Again, the following formula is used to determine selection. But I'll be looking at the cumulative score, which is the only time we look at the cumulative score on the admission assessment exam. And we take the GPA times 25 and add it to that cumulative score, equal the number of points that you'll receive. So the closest to 200 points will be selected. So the example is the applicant had a 3.75 GPA, multiply that by 25 is 93.5, plus 95% cumulative score equals 188.5 points. Applicant 2 had a 3.98 GPA, multiply that by 25 is 99.5, and got a 90% cumulative score for a 189.5. So selection would be made for applicant number 2 for the final slot in this example. Okay, let's look at the timeline again. Application process opens May 1st, 2019 and closes June 1st, 2019. I'm sorry, application cycle. All the paperwork must be received by June 1st, which includes your PERT scores or SAT, ACT scores if required, completion of any prep courses if needed, and all transcripts. The admission assessment exam and information session confirmation post-test are also due by the June 1st deadline. And I'm saying June 1st a lot because I want you to be aware. Everything's due by June 1st. And let's review the application process again. If you haven't already applied to the college or you're not a current student taking classes now, or it's been a year since you took classes, that's the first step. Go to Northwest Florida State College website. To apply, you will apply online and select whether you are a new student or returning student. Have residency forms available. After you complete it, you will receive an email. Please keep it on file. You will log into all college accounts with the username provided. Your college email will be your username at nwfsc.edu. You will also receive a student ID number that starts with an N, which you will need for the nursing application, and lots of other things. From this point forward, we will use your college email address for all correspondence, and we ask that you do the same for us. Go to the selective admission page under Future Raters, scroll down, click on the RN Nursing. You'll find the application packets on that page. Download the appropriate one, complete the required forms, and submit them no later than, you guessed it, June 1st. In one of the methods stated on the form. Remember, you must include your student ID and college email address, or your application will not be valid. Please do not submit your forms before May 1st, 2019. The applications are reviewed upon receipt. And final review of all applications will be completed after June 1st, which will take several weeks. Check your email for updates. When we complete the point calculations, we will let you know. Review our calculations and make sure they are correct. If they are, then you don't have to do anything. If the numbers that we provide you are not correct, you don't think they are, please contact us and we'll see where the misunderstanding is on your part or the error is on our part. Note, please do not contact us during this review process asking for updates. The more calls, emails we receive, the longer it will take for us to complete the process. We promise we'll contact you if we think there's a problem, and you will have the opportunity to fix errors when we inform you of your total points prior to us making the final selection. We will accept 36 traditional applicants and approximately 12 LPN to RN applicants for the spring 2020 class. That means nursing classes begin January 2020. While there is an alternate list, which will be in effect until close to when the semester starts, when classes start that semester, there is no waiting list. So you must reapply. If you are not accepted if you are not selected for the spring 2020, by the time classes start, you must reapply for the following semester if you want. You'll have to submit an application, do the online information session, which will be updated along with the session post-test confirmation form, and take the HESI A2 exam once or twice for the fall 2020 application cycle. That exam I will be accepting for fall 2020 applicants can be taken anytime between June 2nd, 2019 and March 1st, 2020. So if you're not selected for spring, keep checking the website for updates about fall. So you found out you've been accepted. That's the good news. Now what? There are conditions of enrollment that you must meet. You must have a valid CPR card, and it must be American Heart Association healthcare provider, or from a provider that uses American Heart Association guidelines. And this must be stated on the card. If it's not an AHA card, it must state that they follow AHA guidelines. You will have to complete a health screening and submit proof of immunizations. Do not get your CPR done too early if you don't already have it. CPR is only good for 2 years, so if you wait until close to the time you begin the nursing program, it will carry you through the whole program. Also, do not go and get your immunizations right away. You will find out more information about all of these things at the new student orientation. In addition to CPR and immunizations, you will be required to undergo drug screening and a background check. Criminal background check must be completed. Again, you'll find out how to get that done at orientation. A felony may prevent you from enrolling in the program because you may not be allowed to go to the clinical facilities, and then you would be unable to meet the clinical requirements for the program. Depending on the offense, even if you were able to get through the program, you may not be allowed to take the licensure exam. Full disclosure is important. The Florida Board of Nursing will not issue a license or allow you to test for a license if you have been convicted or pled no contest to a felony violation regardless of adjudication, which deals with social welfare, drug abuse, or fraudulent activity. Unless the probation or pleas ended more than 15 years ago, 15 years prior to the application to the board. If you need more information, call the Florida Board of Nursing at the number provided, and their website is also provided. Okay. Okay, for traditional ASN applicants, this is the curriculum with a slight adjustment because I'm going to make a correction here that just got approved. But if you are selected, you're going to have courses prior to starting nursing courses in the spring. Those are Human Anatomy and Physiology 1, English Comp 1, and college level math, core math. So that can be either college algebra or statistics or higher, or practical applications of math, which is MGF 1106. The good news about the MGF 1106 is that it needs a PERT score of 114, whereas the others need a PERT score of 123. So that can make a difference of whether you need to take intermediate algebra or not. If you haven't taken anything and you're eligible for statistics, I strongly encourage you to take statistics. That's what's required in the RN to BSN program, along with one other math. So either one, anything will work in the core math, but if you don't have anything and you can take it, why don't you get statistics out of the way? Then there's other classes, general education classes that you can complete while you're in the program, and you can see what those are here. If you're an LPN to RN and you're selected, you have to have 4 classes done before nursing classes begin. Human Anatomy and Physiology 1 and 2, English Composition 1, and Nutrition. And the others you can get while you're in the program. Again, you'll be starting in the 2nd semester, and then when you're in your final semester, we will articulate 11 credits that will give you credit for your practical nursing work, and for a total of 72 hours for the program. So you will receive your ASN degree only after you satisfy all course requirements. And please remember, you don't graduate as an RN, you graduate eligible to test as an RN. Class schedule. Your class schedule will be for theory classes, depending, and each semester is different, but you'll do 2 to 3 half days, so 2 to 3 3-hour courses or class sessions per week. And then your clinical, it will be 1 full day of clinical. About half the time, starting in nursing process 2 through the rest of the program, you'll be in med-surg clinical. And on those weeks, you have to go the day before to get your patient assignment. For other specialty areas that you'll be rotating through during the semester, you will not have to go the day before. So make sure that you're aware that whatever day that you are assigned for clinical, you'll have to do a couple hours the day before get your patient assignments before your med-surg days. That is not true with nursing process 1, just with nursing process 2 and beyond. Your clinical hours can be as early as 6:30 and go as late as 5 to 5:30. So it's a long day, so be sure you plan accordingly. Do you have any further questions at all? Call the nursing department at 850-729-6400 or email us at asnursing@nwfsc.edu. And be sure to get credit for viewing this information session. Complete the post-test confirmation form found in your application packet. Download, print it, take the post-test, fill out the rest of the information, and get that to us the same way as you did with your application. We look forward to having you in the program and preparing you to become a nurse in today's fast-paced healthcare environment. Good luck.